Thank you, Vladimir, for that very kind introduction. And I do want to emphasize how honored I am to be invited to speak with you. I love this topic, and we'll talk about it anytime, anywhere, but having the chance to talk about it in my first visit to your beautiful city is a wonderful opportunity. So thank you, Vladimir, and thanks to all of you. Vladimir, I need to get from you a copy of that Newsweek slide that you had. It's the only magazine cover I've seen that had not only diet hype, but George Bush and Tony Soprano on the same cover. So I don't know how those work. For my entire career, for more than 35 years, I have worked in some form of health journalism or health communication, in radio, in television, in short 2-minute stories, and in longer 60-minute special reports, on the internet, in a blog that I now publish, on Twitter, I do tweet, on Facebook. So I'm going to talk about really 5 key themes in this field of communicating information to consumers about health. Things that I've observed in my career. Okay. And in these comments, since I am a journalist, most of my comments will be about journalism, not about the broader and sometimes quite different field of health communication. So change slide, please, Vladimir. So these are the 5 themes. Number 1, the method or the channel of communication, now including social media and interactive aspects of new media. Number 2, the content of the news and information being communicated. Number 3, the attempt by some commercial business interests to influence news and journalism content. Number 4, a shift or a change in the relationship between physicians and their patients. And number 5, this clash between intuition and science, or the clash between intuition and evidence. Change slide, please, yes. When I worked for CNN in the 1980s, and that was me 20 years ago.
Sure?
Thinner.
Sure? Sure?
Yes. Thinner, less facial hair, shorter hair. But when I worked for CNN, my stories every night would be seen by easily hundreds of thousands of people around the world. Now, I spend a lot of time every day writing blog posts that might only be seen by a few hundred people every day. And yet, I must tell you, I get far more personal and professional satisfaction out of today's blogging for the hundreds than I did broadcasting to the hundreds of thousands every night. Well, why is this? I believe that this little bit of my personal history is relevant to our discussion here today about social media and about new forms of communication pathways. So my television news work was broadcasting, and it was one-way communication. We didn't know who was watching. We talked, and we assumed that they listened, but we didn't know who they were, and we didn't know if they listened. Now, I write, and I can have some confidence that it's reaching an audience that cares about healthcare journalism and about the same topics that I care about, because out of all the choices that are available in all the media, why would you bother to come to my blog if you didn't really want to be there? And I do know something about who visits now, because they leave comments, and I can react to those comments, so we can have a conversation through the internet. That is a much more fulfilling environment for a lifelong communicator like me than some of the blind, one-way communication of the past. And it must be wonderfully fulfilling for those who once had no publishing outlet to now have that platform. For example, I now, every day, follow some non-journalists whose blogs, I believe, are some of the best healthcare journalism that I can find. One of these bloggers is a psychiatrist. One is an internal medicine physician. A few of them are nurses. And they're practicing what I believe to be premier journalism. And it must be satisfying for those who once had to hope that their letter to the editor might be published, but who now can post a comment or a response online instantly and engage the publisher in some dialogue. When I began covering health and medical news in the 1970s, there weren't very many journalists covering this beat full-time in the U.S. I recall a great deal of journalistic sensationalism and hyperbole. There was very little scrutiny of the claims that were being made. So if a compassionate, intelligent physician or researcher said something, it was considered as good as gold and usually went unchallenged. After about 10 years of reporting in my own career, I had a sort of professional epiphany when I remember being overwhelmed by the flood of bold and unsubstantiated claims that received mostly fawning or cheerleading news coverage. Change the slide, please, Vladimir, thank you. In about a year's time, in 1984, 1985, a U.S. government health official, it's the woman on the left, Margaret Heckler, who was the head of the Department of Health and Human Services in the U.S., this woman predicted that there would be an AIDS vaccine within 2 years. Well, of course, that is 25 years ago. Change the slide, please. There was talk of a cancer cure in coverage of a National Cancer Institute researcher on the cover of news magazines and on national TV. And change the slide, please. Journalists from around the world went to Utah and then to Kentucky following artificial heart experiments that were made to sound far more therapeutic than experimental. And Alzheimer's disease research was made to sound far more conclusive than the evidence would dictate. So AIDS, cancer, heart disease, and Alzheimer's disease, something went crazy in the coverage of health and medical news in 1984 or 1985, and I don't think journalism has ever fully recovered.